The third session is Empowering Action, Translation to Providers. This session, we get to talk about advocacy and what we can do to use our skills as health professionals within the climate and health world. I will start with just the basics, talking about different avenues to empower action and giving you a few examples of what others have done. We'll then hear from Dr. Cecilia Sorensen on medical education and climate change, and then Dr. Corey Bills and Elzari Theron about research in climate change and emergency care. Next will be a case from toxicology, and then finally we'll talk about communication and advocacy in climate change as physicians, nurses, researchers, and other health professionals. Lastly, we'll conclude with our live workshop group discussion. Our objectives will be to define health policy, review the educational landscape of climate and health, discuss climate and emergency care research practices and projects, learn how to apply our leadership and communication skills to climate change work, and then practice skills in delivering key messages to stakeholders and the media. So just the basics. Health advocacy is activities related to ensuring access to care, navigating the system, mobilizing resources, addressing health inequities, influencing health policy, and creating system change. It's essentially how we create positive change for our patients in our community. I really like Community Access's framework. They break it down into 4 main areas. Number 1, safety, equity, policies, and funding. You can be involved in health advocacy in one of these initiatives, such as initiatives pertaining to health equity, or many of your initiatives will naturally intersect across several of these areas. The question is, where will you start? And this has to do with opportunities within your own ethos. So, for example, you could have a lot of local collaborators and partners interested in climate change and health. Those will be a natural fit for you to discuss, form relations, and brainstorm projects. However, you might be the only one in your region who is really interested in the intersection of climate change and human health. Your professional societies, or perhaps even your Minister of Health, would be a great way to get involved then. And then thirdly, I think about global emergency care. So today we're here engaging in this workshop, talking about climate science and how we can be involved as health professionals. We're advocating for emergency care as a human right because in order to provide emergency care, we need climate resilient health systems and healthcare facilities. It can be a really nice avenue to do global health and partner with various international organizations in order to create positive change for your patient and community. I wanted to share one example in Bangladesh of how they are creating change. All right.
Natural disasters are common in Bangladesh.
The climate is changing. It is not like it was before.
Suddenly, when the flood started, my hair got entangled in the jujube tree. My hair had to be cut to get me out of there.
It's been a big scar in my life, and I couldn't recover from it to this day.
It was over my head, and I had to hold on to the spokes of the windows.
The people with disabilities get affected the most when a disaster comes.
I cannot walk very fast or run very fast.
People with disabilities cannot afford a brick house. The wooden house, the wind blows away. There were negative attitudes. You are a disabled person. Why should we include you in the committees? All people with disabilities need to be included during disaster management. Now they include us in the preparedness meetings. They call us to be involved. We have created a list of which people with disabilities are the most vulnerable. Now there is a plan to evacuate them.
I know that when disaster comes, they signal with the flags. And I know what the flags mean.
I think I am safer, and I know about disaster. I inform all the people with or without disabilities.
The other people in the community, they are getting benefited.
My name is Sultan Ghazi. My name is Abdur Rahim. My name is Shahadat.
My name is Shilpi.
My name is Joyful Bibi.
My name is Firdaus.
In decision making on disasters, people with disabilities must be included.
The rights of people with disabilities should be considered. And youth like me need to be included as well. You must remember us.
It is my demand.
Another example of a positive initiative is within Ghana. The capital city created this 5-year action plan, and they not only recognize problems within their country, but they came up with a plan and a timeline to address these issues. And so you can see here in 2015, the waste sector emitted the high share of greenhouse gas emissions in the city. And so the mayor is collaborating. It's part of the C40 Cities Initiative, which brings together climate leaders. And so here you can see the emissions by sector. And then here's what they did. They came up with why they're acting on climate, just like you did to start off this workshop day. Why are you here? Why should we work on this issue even to begin with? So they did the same thing. They talked about climate science, mitigation, adaptation, and synergies. They wanted to improve their livelihoods and reduce the costs to human health. And then they created this vision. By 2050, they want no dumping of organic waste. They want buildings fitted with solar, industrial operators to be electric and have energy efficient buildings and appliances, including air conditioning units. They want vulnerable people, assets, and services protected against climate. And then they want effective climate change governance frameworks, including climate action and community ownership. I would just add, including the voice of health, all of you. This is another initiative in the Seychelles. They have a coastal resilience initiative, and they used some technology in order to map out vulnerabilities along the coast, including hospitals. They addressed the impact to sea level rise. They partnered with their health professionals there. This is a picture from a few years ago, but nurses were really involved and advocating for their patients. So you can go to this site, explore. If you click on critical infrastructure here, they talk about the hospitals and all of their work. Again, planning now for the future as an island nation. The National Health Service becomes the first national health system to become carbon net zero, backed by clear deliverables and milestones. This is in the UK. Again, fantastic work addressing health sector emissions. And then the National Adaptation Plan. Some of you may have heard about it, but national adaptation plans are created as a way to prepare. These are several countries who already have plans in place. You can go to the link and evaluate their plans. But how do we get every country to plan now and every national adaptation plan to include health? Sometimes they're called HNAP for voices of health within them. And then even bringing specific issues such as migration and displacement. Over on the right-hand side, you can see one of our migration reports. It talked about, in the setting of climate change, ensuring that human mobility remains a choice, determine the flows, conditions, and impacts of human mobility, and reduce challenges and increase opportunities of human mobility as it pertains to climate change. And really, the report and the voices of leaders requesting that the national adaptation plans include this. People matter, lives and livelihoods matter. The last part, I just wanted to share another video on the locust crisis and a voice of an international leader talking about locusts. So I'm going to go ahead and start it here.
What we know is that one swarm of locusts actually have about 40 to 80 million of those locusts. And this is almost about 1 kilometer square. And in a day, they can actually destroy food that can feed up to about 35,000 people. And that means that if you put this at the level of a farmer, locusts can eat an entire area that is owned by one farmer between morning and in the afternoon, and that will depreciate the livelihood of that farmer for the entire year. So the impact of this is quite very huge, and it is projected to increase with the latest scientific figures that we're seeing. The changing climate is creating an enabling environment for locusts to strive. What we know from science is that the Indian Ocean has been warming for the past 100 years. And in October to December of last year, the Indian Ocean dipole, which is a phenomenon that comes as a result of the warming of the Indian Ocean, deposited water inland in the East African region that was more than 400% the normal rainfall that happens in the region. And what the science is telling us is that these create a breeding ground, because in semi-arid areas, then because of the rain, the vegetation increases. So climate change is actually impacting in this. And just to put it in perspective, as we're speaking today, 20 of the fastest warming countries in the entire world are in the African continent. If the emissions are not reduced, these episodes that we're seeing, especially with the outbursts of these locusts, will continue. When you look from a policy perspective, over 51 African countries have ratified the Paris Climate Change Agreement. That means that Africa is actually a leader when it comes to climate change action. But what needs to be done now is to turn those policies into action. And therefore, every solution that can then be able to build resilience becomes quite very important. And what is more important is to leverage climate action as an investment opportunity. And engaging the youth becomes quite a greater opportunity, because they constitute over 60% of the population. And if they can be made to see climate action as an investment opportunity, that will be brought to scale very quickly, but more from an enterprising perspective that will be more sustainable.
Lastly, I just want to reiterate how important youth voices are in climate action. The African Climate Alliance is just one example of a group of youth activists. We can all use their energy and enthusiasm for ultimately, it will be their future, it's our future, and they can be extremely vital allies when it comes to addressing climate change and human health.